Welcome back, everyone. Nina, if you could open the line, make sure all other lines are muted, and open the line of Ginger Chu at CDC.
One moment, please. Her line is now open.
Ginger?
Lorraine, yes, I'm here. Thank you.
Okay. As I said before, she is the Deputy Associate Director for Sciences at CDC's Division of Environmental Health and Science Practice. And she was nice enough, even though she's just coming back to us after a stay doing something exciting, she was nice enough to actually agree to present. First time back on the line. So welcome, Ginger, and thank you.
Oh, thank you for having me. I was just wondering, I don't see the arrows for giving controls so that I can advance my own slides during the test
Ginger,
run.
I'll add you in right now. Sorry about that.
Okay, thank you.
Okay.
Okay, great. Yep, I see them. So I was really excited to be my first time back with the CIAQ, and I had the opportunity to present this paper that an EIS officer who was stationed in New Jersey, she's the first author, Faye Rose-Wadowski. She's now at the Florida Department of Health. And I also co-authored this with Hatice Saran, who's in the Asthma and Community Health branch here at the National Center for Environmental Health. And then Faye's primary supervisor was Melissa Santorelli, also in New Jersey Department of Health. When Faye came to me and said she wanted an idea for what she could do for an EIS project, I said, oh, I think we really don't understand what indoor environmental controls are being done based upon race and ethnicity. In several inner-city asthma studies that I had conducted, I had seen quite a few plastic, like around the mattresses, improvised dust mite mattress covers, and I saw a lot of air cleaners in homes. But my feeling is that the Black and Latino populations were still having a high prevalence and a high burden of asthma. So she undertook the study to investigate exactly that question.
Ginger, we have someone on the line that is asking that you speak up a little bit, I think.
Yeah, we're having trouble hearing.
They're having trouble hearing you, so if it's possible.
Okay, someone had told me here at CDC that they couldn't hear me, so I'm speaking right into the speakerphone right now.
I can hear you, so I believe our recording is also going to be getting you, and it will be posted.
Okay, all right, thank you. So the slide is showing the top bar is, and the quote is from the CDC website below, that only 46% of the healthcare providers are providing, for children with asthma, are providing information on environmental control. That they're giving some asthma action plans, and they are taught how to recognize the symptoms of asthma and asthma attacks, but only 46% are being given information about the environmental control. So I thought, oh, this is, we're definitely going to show that, like, the populations that have a disproportionate burden of asthma, that they're not using the environmental control because they're not even given that information from the healthcare provider. And this slide, also from the CDC website, shows the prevalence of asthma, which is on the y-axis. You can see that the Black population, Puerto Rican population, those living below the poverty level, 100% of the poverty level, are experiencing a disproportionate burden of asthma compared to other demographics. This is what we found was supporting that in our assessment. So we do an asthma callback. I might have skipped a slide. All right, should go to the slide first. So what we decided to do is that we're going to look at the Behavioral Risk Factor Survey Systems. It's the BRFSS, and that's a population-based survey. In 2013 and 14, if an adult respondent says, yes, they have a child with asthma, then they call back the family a few weeks later, and they ask a series of questions specifically about that child's asthma. The population comes from 14 states across the country, and we aggregated Black, non-Hispanic, other Hispanic but not Puerto Rican, other race, and the reference population was white, non-Hispanic. So every comparison we did was compared to the white, non-Hispanic group. We also saw Puerto Rico itself and compared all the children in Puerto Rico with the reference being all the children in the 14 states. So we have these two different studies. And just to make sure that we still had a high prevalence of Black non-Hispanic, you can see about 15.7% have asthma in our Black non-Hispanic population, and about 12.9% of the Puerto Rican children in our population had asthma. So this still shows that the Black and the Puerto Rican children still had a higher prevalence of asthma, especially compared with the white non-Hispanic, which is about 7.1% in our sample size. And these were our results. We found that the non-Hispanic white, this is our reference group, NHW, and then non-Hispanic Black, primarily African American, we believe, but I cannot say for sure. Compared to the white population, they're using an air purifier. Compared to the white population, again, they're using dehumidifiers. Compared to the white population, 94% versus 90%, they're not really smoking in the home. These are children with asthma, and no one in the home is smoking. So that's great news that I thought. And if you look at the Puerto Rican children in our sample, you can see an example of like use of mattress encasements. About 60% of the children are using mattress encasements, 53%, much higher than the white non-Hispanic population, are using dust mite impermeable covers. So what is a little misleading about just showing prevalence is that you're not adjusting for all of these covariates. So we know often that race and ethnicity are tied in with income. So these odds ratios in this slide, they're just for age, but household income and education level. So keeping all those things the same, you can see, compared to the non-Hispanic Black or white, that the Black children are having 2 times higher use of air purifier, 1.84 times higher use of a dehumidifier, and then no pets in the bedroom. The Black families are definitely using no pets in the bedroom, much higher, 4 times higher odds ratio compared to the white families. Then if you look at the Puerto Ricans on the mainland, not Puerto Rican Island, but Puerto Ricans on the mainland, they're compared to the white reference group, they're still using 3 times higher odds of using an air purifier. Then if you look at other Hispanic families, they're using kitchen exhaust fan, 1.79 times higher, 1.8 times higher using washing their linens in hot water. By the way, washing linens in hot water is no longer based on the most recent dust mite practice parameter. It doesn't really have to be hot water. You can conserve energy. The dust mites will drown. So you can, but at this time when it was asked, the question was, were the linens used in hot water? And for years, the families have been given direction for environmental control to wash in hot water. So that's why we use this question. And then if you look at the non-Hispanic, other no pets in the bedroom, this group has a 2 times higher odds than the non-Hispanic white families. Not as high as the Black families. But one of the final things I want to point out is using dust mite mattress covers on the island of Puerto Rico, 3.6 times almost higher of using these mattress covers. So in Puerto Rico is very humid. Across the island, they're likely to have dust mite exposure. So they are getting the message about, for your child with asthma, you should be using dust mite mattress encasements. They're getting the message to use them. However, we're not sure if they're using them properly. They're expensive. It's hard to maintain those, so not sure how old those are. I think that what we need to do is, and I'll put this in a summary, is we know that families are using these indoor environmental controls. They're getting the message. However, we need to find out what those barriers are to having effective home intervention practice. And I think additional studies of the practices and the asthma outcomes, we didn't look at the asthma outcomes for these children. We just want to know, were they using these environmental controls or not? I think you need a different study design, like a pre and a post, and some extra follow-up measurements to see if they're maintaining the use of them. That if you did that, you might be able to show that they're getting the message to use them, but maybe they're not able to maintain using them correctly or be able to use them correctly in the first place. So I think we need to focus a little bit more on how to get rid of those barriers and understand how to improve indoor environmental control. So that was a lot because I was pretty excited about this paper, but I would be happy to take any questions about this. Again, the first author is Faye Roswadowski, and she's not on the line today, but we have included a citation in the meeting minutes for the CIAQ that lists the paper and how you can find it.
Thank you so much, Ginger. We're going to, I forgot to mention to everyone, if you have a question for Ginger or for Dr. Chan, which will be coming next, please put them in the chat box on your screen. Do we have any questions in the room at this point? Okay. So Ginger, one question. So your conclusion here is that even though they're using them, they may not be using them properly. So what would be the suggestion to correct that problem?
I think we really need to have tailored home assessments. And in the meeting minutes for the CIAQ, the first thing that we mentioned in the CDC is the home assessment training for home visitors like community health workers to work with the families and understand they're getting the message about that they need to do this, but how to do it effectively. Because the Puerto Rican and non-Hispanic Black children, they still have such a high prevalence of asthma, and they have such a high prevalence of burden of asthma, hospitalizations, ED visits. So even though all of our agencies are pushing to use indoor environmental control, I mean, we say try source control, try to control your allergens or asthma triggers at the source first. Somehow that message is not effective.
Okay. Do we have any other questions at this point? Any questions in the room at this point? I'm looking forward to reading that article much closer because it's a lot harder to see the stats without having read all the way through.
Hey, hi Ginger. This is Tracy Washington-Inger, and I also wanted to get a chance to look at this a little more deeply too, because as you know, the recommendation that you were making there about better, more tailored interventions is something that we at IED, we and the Asthma Disparities Working Group, all of us have been supporting, and the papers like this that indicate that that's the right direction to go help us also with the big hurdle that we have with acquiring sustainable financing for those particular kinds of interventions, especially for our frequent flyer kids who are having the worst kinds of outcomes and who require a different level of intervention, especially in the home, and getting those services identified and then getting them reimbursed so they're sustainable. So this is tremendous. It's really good to see every piece of evidence that helps support our efforts in that direction are great. So I look forward to continuing this conversation, hopefully in in a near future Asthma Disparities Working Group session as well.
Oh, that would be great. Thanks for your support. We were just really surprised to see these results. We expected, like, oh, they don't even have access to indoor environmental controls. They're not getting the messages. I could not believe, like, Hatis and I double-checked her code, making sure that she was, did you code yes, no correctly? So this is really pretty amazing.
Yeah.
Thank you.
Yeah.
Okay, Ginger, we have one question.
So, oops. I'm sorry if I mispronounced your name. Alahili Banos was wondering, it would be interesting to know how many of these families live in multi-unit housing where they may be exposed to triggers they can't control from neighboring units. Was that looked at?
Oh, I do not know, but I think that is a great question. I'm flipping through the paper right now to see table 2. No, we did not look at that question. But I think in a subsequent analysis we could take a look. Thanks for the insight. And it's possible that maybe Faye did look at it and it dropped out of the model. So I'm not, it's not in the paper, but she might have looked at it. But I'll check with her. Thank you.
Thank you. Do we have any additional questions in the room? Any in the box at this moment? Okay, we're going to move on. Thank you so much, Ginger. That is really, really interesting. And I'm looking forward to seeing where we go with this from now. All of this information is, because it's all about helping the public. So